Part 2. Apparently I went too long and the camera just shut off. Sorry. As I was getting to the optic ointment and optic drops. So optic ointment is going to go to the right eye daily in the morning, and the optic drop is going to be 2 drops to the left eye daily. So when you do have the patient, you want to have them in a semi-laying position. But what you're going to do is hold the optic drops at the top with your dominant hand and pull down the eyelid. You can kind of grab down by the cheek, pull down the eyelid. You want to have the patient look up so it doesn't touch the pupil. And then aim for inside this lower eyelid. So again, forehead, I would have the dropper. He would be laying 45-degree angle, probably in his bed. So not laying all the way down, but not fully upright. Fowler's position would probably be best. So I do that, and I drop it inside the eye. If an eye drop does miss for some reason and hit the patient somewhere else, again, administer the eye drop. Do not touch the top of the eyedropper to the patient's eye or skin at any time. You're going to contaminate that whole eyedropper. So then, I'm demonstrating how to do these. So the drops do go in the left eye, which I do have over here, and 2 drops. So I would administer 1 drop, have him blink, and the next drop and have him blink. You're going to want to wait about 10 seconds or so in between each drop. Give the patient a tissue because their eye will water. Excess medicine might drip out. So just let them have a tissue to do that. So then in his right eye, he's going to be doing the ointment. So for this, I would have the ointment tube. I would pull down his lid, have him again look up, and go from the inner cannula to the outer cannula. I would lay it right inside the bottom eyelid, and then I would have him close his eyes and gently massage, and then have him open his eyes. This again might cause some tearing, so separate tissue. We do not want the same tissue used for both eyes. Just a blot if his eye tears. Again, with this medication, you want to check against the MAR, make sure it's the correct medication, make sure you are going in the correct eye. That's very important. And let him know. So side effects for these eye drops would also be burning, stinging, as I said, blurred vision for both of them. So once we do his eye drops, the last is his otic drops. I'm going to take my dropper. I'm going to want him to lay on his side, or he can tilt his head. You can't really tilt this stuffy. So I am going to grab his earlobe and I'm going to pull it up and out to make sure that I elongate the canal. I again do not want to touch the dropper to his ear, will contaminate it, and I'm not going to put a dropper inside the ear canal. That can cause injuries. So I'm going to hold it. I'm going to pull the ear up and back, and drop however many drops it says into his ear. These say 2 drops to the right ear twice a day. So this is morning and night. And as I had mentioned to him before, but I would reiterate, you can feel dizzy and nauseous from this. Once I put the medication in there, we'll have him hold his ears shut and continue to hold that position. When he is ready to sit up, I can also put a cotton ball, small piece, in his ear to keep the medication in his ear canal. So, I also want to mention, if it was a kid, you would pull it down and back. That is kid under 3 years. So, again, documenting everything, making sure that I correctly document whether the patient tolerated the eye drops, whether the patient tolerated the ear drops, oral meds, the patch, nasal spray, an inhaler. I can just say patient tolerated. I try to put those 2 words together. Patient tolerated procedure, or eye drops, ear drops, otic drops, optic drops, to be professional in that. And again, after I am done, hand hygiene, removing the gloves, hand hygiene. So, he didn't have any intradermal, subcutaneous, or intramuscular to do. So I'm going to demonstrate and talk about that. Again, I would want to identify the patient. When I pull the medication, I'm going to make sure that it is the correct medication. Check that 3 times before I even get to his room. Against the MAR, against the Pyxis, and against the bottle. Because some bottles you might have to calculate a dose. And then you can ask a fellow nurse to do the calculations on her own to make sure that you are doing the correct dose. Make sure both of you get the same number. So as far as these goes, I'm going to do, of course, the 5 rights again, and then the 6th of documenting. I'm making sure that I'm doing that with all medications. I would also do what I did before in the video, identify him with the 2 identifiers, introduce myself, tell him about the medication, what it's used for, what are some side effects, and if he has an allergy to that, go over all the allergies again. So basically everything I did at the beginning of the video and throughout the video, I would do again before I administer these drugs. So first, I guess I will just go through intradermal. For the intradermal, I'm going to use, depending on the medication, how it's delivered, either 1 milliliter or 3 milliliter. I'm going to use 25 gauge at 5/8 of an inch. This would be equivalent to like the flu shot or your shots that you get. So you want it to pass the dermal, but you want it to go above the muscle. So that's why you would use 5/8 of an inch would be best option in here. As the 1mm. Again, this would be done in the medication room where you'd be drawing this up. You can, if you really want to, draw it up at bedside, but this would be the needle. I have vials. I'm not actually going to do this on the video because it takes super long, but if I'm going to pull out 0.3 mLs, I'm going to pull the air to 0.3 mLs. I'm going to insert that air into the vial, and then I'm going to draw out 0.3. So to measure this might be hard, but you want the top of the plunger to be at the 0.3. Once you get it out, you do want to tap it, make sure all the air bubbles go to the front. If there is some air, you can go back, push the air into, and draw it again. Make sure that it is precisely the 0.3. Again, tap air out. Make sure it's just liquid going in. And then for these, you can do the arm, the upper back, and I believe your abdomen. You're going to pinch this. Oh, you can't see this unless I lift it up. Okay. Pinch the skin. You can go in at a 45-degree angle if it is a skinnier patient. Otherwise, you can go in at 90 degrees if it is a little bit larger patient. You would slowly get the medication in and then pull out. You would hold gauze over it, put a band-aid, and when you are done, you want to use 2 hands. Can I get it? The needle. Oh, no. Why can't I get the needle safety device to work? You would want to there we go. You would want to use a needle safety device. And when you are done, go straight in the sharps container, which I don't even have open. Oh, today, what a day. Whatever. This would be open. You would throw it in to use needle. If it is multi-dose, you would want to waste the rest of it. Have a nurse, double check, sign off on the wasting. Some other things are, if you do draw up you're in the med room, you draw it up. You do want to label this syringe with the medication, the dose of the medication, and your patient. So I've demonstrated how to pull the medication out of the vial. So I will get moving on to the intramuscular and the subcutaneous. You always, I forgot this step, you always want to wipe it off with an alcohol pad before you go stabbing. You don't want to contaminate the insertion. So one other thing to point out is you do not want to massage the medication in. And then, okay. I'm going to put this back in the package. Don't do that in real life. As far as a intramuscular, and depending on how much medication you have to draw up, these are the ones in the kit that I found. These are both 3 milliliter. You can go to 5 milliliter if you have to, but you do want to use the smaller number that you can for greater accuracy. You can use a 1 inch for a very skinny, petite person, up to the 1.5 inch. So I do have both here. For these, I'm going to kind of use this again, and I'm not going to pull that safety back down because that is unsafe. But I will use this. I did show you how to drop the medication. Again, label it with the medication and the dose that it is. Pick the site that you want to go. So this one is either going to be in the gluteus maximus, not maximus, the gluteal muscle on the side of your hip. You will identify it by the iliac bone. With your hand, and make a V and go in the middle of the V. So this one, you do want it to pass through that dermal layer, all the way through to the muscles. With this one, I've drawn up the muscles medicine. You do, again, can't see, squeeze up, go at 90 degrees, push it in again slowly. These doses are usually a lot more medication, which is why you put it in the muscles. It is important when you do go in the muscle to pull back the plunger. Make sure you're not pulling any blood, because that means that you did get right in a vein. So you're going to want to move that needle to where you don't have any blood coming back. So you stick it in, there's no blood. You do deliver it slowly. Again, put a band-aid on the outside. I don't know if I missed wiping it with an alcohol pad. That's intramuscular. And then for subcutaneous, you are going to use a very small needle. It is going to be either a 3 or 10 milliliter, again depending on what medication you're delivering. You always want to use the lowest number possible for the accuracy. This is going to be a 29 gauge needle, and this will be a 1/2 inch. So you want to use the smaller needles and the larger gauges. This one is often used for insulin. You can see it is very small. This is one that they would also use to test TB. So with this one, you want to go at a 5 to 15 degree angle. You want it right under the skin. When you do deliver the medication, you should see a little bulbule. That's where the medication will be sitting. Again, don't push on it. Don't recap the needle like that. I just did that so I can use it again, which you should not do either. you will see a little bulbule of medication under your skin. Inform the patient, of course. Don't pop it, don't push on it, don't massage it. And that you're going to be looking, if it's a TB test, right away. If it is insulin, you should not have the little bulbule. You should go deeper into the dermis, but you are still going to use the smaller needle. You can do the 45-degree angle for insulin.